myself after
Hi, welcome back everybody. Look, we have some smiling, well-behaved gentlemen on the panel. Hope you've all had a fantastic week. It's Friday again, can't believe it. Hope you all had a fantastic Easter. Gentlemen, how was your Easter break?
Very nice. I get used to 4-day weeks. It's all good. I didn't go back to the garden centre, but you know, it was just nice not doing anything, just
Good
sitting
weather.
around.
Good weather.
Weather was nice, yeah. So
weather was nice. Where were you, mate?
Yeah, no, I like a bit of snow.
Okay.
There you see.
Nice
Jumping to conclusions about what good weather is.
I forgot you're skiing, aren't you?
Yeah. Well, I didn't make skiing this year, so that was as good as it got. You know, I should have stood out in the garden with an Aperol spritz or something and put my salopettes on. So that was good. And then obviously back to work. I'm getting lots of very severe resorption cases, and obviously, you know, again referring back to the old Facebook implantology, seeing a lot of these zygomatic cases floating about. I don't know if you're feeling brave or whether you're heading down that route at all. Is it a step too far?
I'll be honest. It's funny enough. Sorry about this chair; it's a bit squeaky. Sorry, funny enough, I was speaking to Evo. You know, the guys that are coming and doing the sort of the immediate full arch things, and I was talking to. I can't remember her name. I should remember her name because she's probably going to watch this. Oh,
her.
Yes, lovely lady.
Lovely lady.
Mrs. Evo.
Blonde, brown hair.
Yeah.
You know, tall, short lady.
Short, small.
Yeah, that's it.
Annabelle. I do apologise. I suffer with nominal aphasia.
She's never going to speak to you again. So that's
end of that conversation.
Yeah.
Christmas card.
Anyway, Bob, I was chatting to her.
Moving on.
Yes,
and and she was telling me that they're starting a course for they do pterygoids, but they don't do zygomatics. And on their course, because what they do is, I mean, the way they've got it set up is fantastic. So they teach their clinicians how to do the full arch process, teach them how to do pterygoids, and now they're going to teach them how to do zygomatics. So as part of their enrollment protocols, they teach their clinicians how to do these sort of full arch cases. So they're kind of at a competent level before they're, you know, able to treat the patients, or they ensure they are by giving them the appropriate education. Okay. So she was asking if I was interested, and I spoke to Guy, or inquired about Guy's course and a couple of other courses. And then I was weighing up how many cases I actually get that, you know, I might be placing them on. And I just thought it's not really going to be a massive practice builder, and I'm probably going to have the skills and I'm not going to be using them. It's probably easier for me to refer to the people that have done a lot more than I'll ever do. So no, simply put, but I've thought about it.
So for those non-dental that might be listening, gentlemen, I mean, I know what the zygomatic implants are, but in sort of like a nutshell, if you want to share with the people out there.
They're a bit longer than our normal ones.
Okay,
yeah,
so would you place one
implants
here, or would you play?
Yeah, so they go up into the bony bit in your cheek here, and you try not to skew an eyeball whilst you're doing it, to put it bluntly.
Yeah.
So I guess these are the factors. You know, you're getting ever closer and closer to, you know, significant vital structures, aren't you? So you've got to weigh that in. I guess you've also probably got to look at your indemnity. I would imagine that's going to get a hike as well, isn't it?
I would have thought so.
So you probably your first few cases are going to go on your indemnity fees. I don't quite know what the going rates are for this sort of thing.
Anything you would consider, Will? Are you interested in that sort of course?
Do you know what? I'm interested in it, and so from a sort of enhancing your clinical skills and having another string to the bow and sort of being able to do a fancy procedure, you know, you like the idea of it, but exactly like Carl was saying, how many am I going to end up doing? You know, so then if you're doing, you know, 2 or 3 a year, why not have somebody who's
Refer
doing
out.
20, 30 a year, who could probably do it a lot better. So that's my position at the moment. Who knows?
Yeah, same as mine. But if you are interested, Will, I've looked at quite a few of the courses, so I'll punt them your way, mate.
Well, thanks very much.
Because they look good. They look good. Obviously, they couldn't run them during the lockdown, but they're sort of, I can see them opening back up again.
I think it's things like, and I'm sure you get taught all this, but sort of, explanting these things, and nothing's 100%, is it? So we've all got, or I certainly have got, significant failures that I'm quite comfortable. I know how to dig myself out of and get fixed, but that sort of thing. I guess I don't have the experience with it, and how bad can a complication get? Probably quite bad, I'd imagine.
Yeah,
he said.
Yeah, it can be quite serious with these things, can't it?
Yeah.
If it goes wrong.
Yeah, but I guess the same with
where'd you go?
Same with pterygoids as well. You don't want to be getting into infratemporal fossa and things like that, do you?
Not really.
That's not a good thing, by all accounts. I hear.
No. No.
No,
I get the odd complaint.
Possibly. Yeah.
And
so anyway, how was your week?
This week.
Me. Sorry. Yeah.
Well, we were just saying just before. Yeah, we were just saying before about the consults back to back again. Just they're still flooding through the door, which it's great. But as you can imagine, they're all wanting it done sort of yesterday, not tomorrow, yesterday. So just trying to deal with their expectations with not being able to always get them in, perhaps as soon as possible.
Yeah. I think sometimes there's kind of like, once that decision's been made, then it's a little bit like when when you've got this online ability to order things, and you can click, and you've got Amazon Prime for those individuals that are like me and they want it now. And although I've probably waited 4 or 5 months pondering looking up the reviews, I want it now. What do you mean you can't deliver it today?
Yeah.
Oh, all right then, Saturday I'll do.
I want it.
Well, you guys probably like me, probably have so many patients go 3 months. What? 3 months? 6 months? What? So I get the 2 straight away, do I? You're like, no. I almost prefer the patients who've done a bit of Googling, who kind of start telling me what the process is, and quite, by and large, they've kind of got the gist of it, haven't they? They sort of know what's going on. It's, the uninitiated who are, quite staggered at the rate of bone healing, their bone healing. Sometimes you're like, yes, it's not me. I'm not just doing it for the hell of it. It's that's how long it takes. So there you go.
I think the indexing stage is always interesting. So when we've done the placement, so the next time we see you, we're going to take some molds or a scan. We're going to send that off to the lab, and then after you'll come back and we'll get you your crown. They come in indexing. So do I get my crown today? Nope. Not today.
Yeah. That's not as bad as the patients who turn up for their placement surgery and just go, so what are we doing today then?
That signed consent that you signed.
Yeah. Everybody stop. Take your gloves off. Just stop. Get my models out.
What, you're going to do it now?
Oh, today is it? Oh, okay.
Yeah, I wondered why you were dressed like that.
Yeah, well, glad it's not just me.
No, it's not just you, mate.
No. Not just you at all.
Well, I probably had different weather to you then, Will, although we don't live too far away, because on Saturday and Sunday and Monday, I was frozen. We went for a walk not too far away, met up outdoors, just in case anybody's listening. COVID police.
Yes.
Yeah. 2 meter distance. Excellent. Or more.
Yeah.
More than a group.
Yeah.
Yeah.
You bring your 2 meter rule with you, don't you?
I had like a hoop. Had a big hoop.
Yeah, around you. Yeah. Like a radius.
Like a sandwich board, but just a big hoop.
Stand away.
Yeah.
In fact, I saw these great masks, going slightly off topic, that they look like your mask is around your chin.
Oh,
But actually, it's the whole mask, but it's got a fake nose and a fake mouth on it. But there's a little mask on it like this. And this one woman's going, pull your mask up. So he pulls his mask down to reveal his mouth, and he goes, I've got it up. And puts it back. I thought that was genius.
That kind appeals to my sense of humour. It's slightly warped, isn't it? Yeah.
Yeah. I thought that was fantastic.
Did you really not have sunshine on Easter Sunday? I mean, it was that warm.
I was asleep. I'm getting old now. Just fall asleep. Easter Sunday. Yeah, it was. There was a snap, wasn't there? There was a snap from warm to cold, and then went running on Tuesday and got snowed on. So,
yeah.
Covered in snow, which was really, really good fun. And then, like you said, Kate, lots of consults, some nice trips, and then met a chap, a really interesting character that got chatting to. And I don't know whether you've seen the film on Netflix, but the Seaspiracy film, and he's involved in that. And I'm fine to talk about it because I asked him.
Oh, yeah.
And so we got chatting. I watched that last night, and I don't think I'll eat fish ever again.
It's a tough watch, isn't it?
Yeah,
it's a tough watch.
Yeah.
Have you seen it, Kate?
No, I haven't. No. We were talking about it this morning. I don't know if I want to.
Yeah, I know.
I've got fish for tea.
Yeah. Just don't think about it tonight. But you will give it a second thought. It was one of those. My son told me about it, and he said, "Oh, you won't want to eat fish." I'll be like, "Yeah, be fine." But just like,
yeah, and I was like that.
Oh, do you know what?
Yeah, it's kind of, maybe I don't want to eat fish again. And I'm not easily swayed by stuff like that. To be honest. I've watched lots of films when, I used to eat a lot of meat and never really, but this, for some reason, I just thought that is unbelievable.
Because there was the vegan, documentary, wasn't there? I don't know if you saw that one on Netflix, which was quite good, talking to lots of athletes, but, it was quite sort of propaganda-ish, I thought, from that side of things. So there's lots of good things, I think, about being plant-based, but, it wasn't enough to make me exclusively think that that's it, I'm going to go, plant-based as a whole. But yeah, Fishspiracy. Seaspiracy. And Fishspiracy, that's the
it's all good.
It's So
I mean, he might join us. Actually, he might come on and have a chat. He's a bit busy at the moment.
What was his role again?
Marketing? He does the marketing for Sea Shepherds.
He said that the sale of the T-shirts, they didn't actually have a T-shirt for that actual Netflix film, did they? But he said that the sales went through the roof of all the other merchandise that they had because of this film.
However, I must say, I've tried the no tuna alternative to tuna, and it's a no tuna.
Okay.
It looks like cat food. I'm not trying to put anybody off, but it looks like cat food when you open it. But the cat would look at it and go, that don't smell like fish. That don't look like fish. That don't taste like fish.
Oh, is it a plant-based copy?
Yeah, it's a plant-based copy of tuna. So what you need to do with it is mix it with a lot of mayonnaise, mix it with a lot of pepper, mix it with a lot of lemon.
So you can't taste it.
Yes.
Yeah, and then probably put some seaweed in there just to get the kind of the taste of the sea.
Yeah.
And then close your eyes and it will resemble tuna. But as an alternative, as an alternative, it certainly isn't going to harm any dolphins or whales or sharks or tuna.
Well, there you go.
It just might hurt harm humans, but it's fine.
Doesn't matter. Yeah.
But I mean, it's what it is, isn't it? But it wasn't what I expected. Shouldn't have read the reviews, really, shouldn't I? Really, but
Do you know what? It's a shame. Sorry, go on, Will.
No, I was going to say, obviously, I feel the sense of one-upmanship now that he's talking about, movie things that he knows. I feel I've got to get my today's movie person story in. So, I had to do a composite for somebody who was going off to be in a Disney film today. Yeah, that was a little bit like, yeah. I was like, ooh. I was like, is my composite going to be famous? Are you going to speak to it? No, I definitely will give him a Will Murphy mug. No, if I got one spare, I'm sorry, Kate. I apologise.
Will Murphy.
Just think of the traction. If he can sneak that on set.
Oh yeah, that product placement.
Phenomenal. I'd love it.
Product placement, yeah.
Did you sort of like engrave WM into the composite?
Oh yeah, it's very artistic. So there you go.
Oh, did they talk
pressure.
about the film much?
Not allowed to do stuff like that. Not allowed to put stuff like that in patients' composites or underneath cranes or anything like that.
No.
That would be regarded as a breach of the GDC regulations. But then the GDC, what have they been up to then? Just sending out private investigators to CDTs, to entrapment? Maybe
is this what's going on there then?
Being slightly unlawful. They've been found to have committed an unlawful act. Because they sent out private investigators to effectively entrap a CDT and try and get the CDT to. I don't know the full details of the case, but I've read it, but they kind of set up a fake patient and tried to get the CDT to visit this patient and played on the CDT's kind of emotional side. But this was all done with people that they employ, private investigating term, all done by the GDC. And I just think that's not what they're there for. You're not there to cause people to breach their regulations and rules. You're there to identify the people that, might not be performing as well as they should be performing and kind of have a word and kind of bring them up. That's the whole spirit of the GDC, is that we abide by. It was the minimum standards, and if you fall below that, then you could be told off.
And you would have thought they send out a letter with a warning saying, you may have a case to answer if they suspect, rather than catching someone red-handed, or filming them like it was the guy in The Sun. It was the fake sheikh, wasn't it? Who for the Sun and the News of the World, who used to entrap people like Sarah Ferguson, trying to give access to Prince Andrew and stuff. It's kind of like in the realms of Sun reporters, isn't it? It's just all a bit rubbish, isn't it?
You can't quite believe this is our professional body, and they talk about us bringing the profession into disrepute, and then they behave like this. And I can't understand who would even say, yeah, that's fine, go on, crack on, we'll pay for that. Well, we'll pay for that.
We do pay for it. Yeah, exactly.
I know he's paying for it.
There you go. Money well spent.
Yeah, with our money well spent.
Yeah,
just
hey ho.
Just think, it beggars belief when you read this sort of stuff. You just think, I just can't understand.
For me, I always think when you read something like that, unfortunately, I am a girl with a glass half full, as people will tell you who know me. But I always think, what's next? If they're doing that and sending private, what's next?
Yeah, I know.
It's a shame. It's a shame.
So if somebody with a false nose and moustache comes in asking you for a kidney transplant, Carl, just,
refer them to Will Murphy.
Just be careful.
A couple of weeks ago.
If they play on your heartstrings, just don't be tempted to get the handbook out.
It does make you.
Hey, hold the book up higher. Hang on.
Yeah.
Did he say left or right kidney?
Doesn't matter.
But it does make you kind of not that there are strict rules in this, but even the patient that we were chatting to, one of the patients had said that he was in absolute agony, and he just happened to be at a party with his dental friend, and his dental friend had been drinking, but he got talking about how bad his tooth was. So the practice was over the road effectively, and opened up, had a look, and he said, but he probably these days he'd be struck off for that. And I thought, isn't that sad that he wants to help him out, but because he's had 2 or 3 over the limit, he's deemed as, if that patient made a complaint, that would be deemed as a breach of the GDC standards, and he could be struck off for something as simple as that, or burping, or whatever else it is. For this frivolous kind of complaints. It's just
it can happen. It can happen.
Yeah, and I just think that's sad. But the guy was fine. I mean, it was only the one kidney. It was the left one. He was okay. I'm pretty adept at that sort of stuff. Yeah. All done with the local as well.
You can always put it back if it's the wrong one anyway.
Yeah. It's tricky with the 6 zeros though.
6
Oh.
zeros. Yeah.
Yeah.
If you could borrow somebody's endo microscope, you can usually hook it up good enough, I think, anyway.
What I
As you-
love is that you're both talking about this with straight faces.
Yeah, well,
Yeah.
I didn't use a microscope. I used the guy that does the repairs for the watches on the repair shop,
Oh, yeah.
and he uses the double lenses. I was using those.
Okay.
They're perfectly fine. Bit grubby, but
Give me a little.
yeah.
Good old
Cross
fashioned.
infection.
Yeah, it's all fine. It's overrated.
And saying actually about cross infection, Will, I mean, again, because of the way we travel around and we talk to different practices, there's still some issues with the PPE in the practices getting certain items.
Oh, really?
Yeah.
Gloves, nitrile gloves, sterile nitrile gloves, actually.
No, I think we've got some of those. We were struggling to get hold of biogels in one of the practices, because by and large I tend to just use the good old-fashioned biogels, but I haven't had any trouble. What are you after? Sterile nitriles, is it?
This is one of the nurses has got. Sorry,
Yeah.
I'll be quiet.
Yeah. No, you're right. It was just that one of the practices she was struggling, and we're just taken aback sometimes because you think that the PPE was a bit more flowing. I think, but not so.
I think it's marigolds, isn't it? Really, it'll have to be.
Do they survive a sterilisation cycle?
Yeah, I think they're all right, actually. Yeah.
For anybody listening out there, maybe don't try it.
We need a thing that flashes up. Joke. Not serious.
I had a year ago. It wasn't a year ago. It was several years ago. I had a bless him, and he came for his interview for the FD, VT, as it was then. And in the interview, he said, "Oh well, my professor, he's not a great believer of gloves, and he explained to us that you've got a natural barrier with your skin, so just washing your hands is absolutely fine." And I'm thinking, probably not the best thing to say to me in an interview for a potential VT position.
Absolutely brilliant.
And I mean, this professor may well be right. I've got no idea, but we don't really kind of adhere to the fact that you don't wear gloves when you're treating patients.
It just seems so culturally wrong now, doesn't it? Because I guess we've always done it since we were students. Maybe a couple of generations before, I think that was that was the way it was. It was hands in, wasn't it?
When I used to work in the hospitals, when we used to have the samples coming in, the urine samples and all the other samples, some of us didn't wear gloves. I can safely say I didn't always wear gloves because it wasn't it wasn't really necessary. And you'd open these things and they'd spill a bit, and you just go and wash your hands.
Yeah,
that now is just unbelievable. It seems disgusting now when I think about that and talk about that. I mean, the disgusting part actually was you'd line up the little poo samples on the windowsill. I may have told you guys this before, and it'd be the summer, and
we haven't had this delightful story yet.
You learn how to do things one-handed, so you have your other hand free to take the sample with, and you undo this little poo pot, and it goes, and you just get this waft of, and then you have to sample it
of somebody else's.
Yeah.
That's somebody else's is not good, is it?
Yeah, there were other
your own is fine, but somebody else's
is not fine.
No.
Yeah. The one that
are we moving off the subject again? Sorry.
The one that the most of the staff didn't like, who were female, was the sputum tests, where people have coughed up the phlegm.
Yeah.
And you're kind of testing it for TB. So you put it under the microscope, and I mean, that's as it infectious diseases go, that's incredibly infectious. So one little bacilli will, really cause a lot of problems. So they used to test for that, and they used to ask me to do the test because they used to hate this kind of gluey mass that you used to have to pull out of the dish and plate up. But they were quite happy testing the poo. So, and I didn't like doing the poo. I used to like doing the not like, it's not the right word, but I didn't mind doing the sputum tests. Anyway.
Each to their own, eh?
Yep.
Each to their own.
Nice.
Each to their own, indeed.
Well, thank you for that anecdote.
It's a pleasure.
Well,
I stayed at the right end.
Tea now. Lovely.
I was going to say, actually, on that note, gentlemen, I think we will call it a night. Will Murphy, yet again, thank you very much. Carl Horton, thank you very much. Absolute pleasure. Hope you all have a lovely weekend, and see you next week, guys.
See you all. Bye.
Bye. Bye.
He's off. Fist his finger.